Hello, everybody. This is Tom Wilson. I'm here with Adapt Productions today, and we have as our guest Kira Meskin, and we're going to be talking about protecting people with disabilities during the pandemic. And I have a number of questions I'm going to ask her. Kira, how are you today?
I'm doing excellent. I'm so glad that you're interviewing me.
Okay.
Yeah.
I know you were on once before, and we were talking about the importance of people with disabilities getting masks and how there was a real barrier to that.
Yeah.
Can you reprise that briefly about, I know you started a group that made masks and distributed masks, and just give us a little background in that area?
Yeah, sure. So I am one of the leaders of a coalition called PPE for People with Disabilities Coalition, and it is ran by and for people with disabilities, and it started early on in the pandemic in response to the issues about we were finding that a lot of folks who live in the community, as well as their personal assistants who come to their homes, were not receiving or being able to access the necessary equipment they need to protect themselves during those times. And what we really want to avoid is people getting sick and going to hospitals, which may ultimately cause them to end up in long-term care facilities, which is the last thing we want. Yeah. And so what we did was we came together with various folks, both in the academic world, such as Rush University and University of Illinois at Chicago, as well as their assistive technology unit, and then various disability advocacy groups, such as Progress Center, Alliance for Community Services, Chicago Adapt. And so we came together and worked on accessing and distributing personal protective equipment such as masks, medical gloves, face shields, hand sanitizer. We also got reusable gowns that were made by medical students, and really engaged in a grassroots effort with volunteers to work on getting them to people's homes. And we made those packages personal, individualized for each person based on their needs.
Yeah, I understand there was a governor's order that the state should provide protective gear to people that were in their programs. What happened with that? They seem to have failed, right?
Well, so that was something that I recently learned about. It was not an executive order, to my knowledge, that was highly publicized. I mean, I never heard of it being shared on media, that this was something that was being asked of employers. So yes, Governor Pritzker signed an executive order 32, which is requiring employers of home care workers, whether it's employers that are funded by Medicaid waivers, or these are private companies, and that includes long-term care facilities. They are mandated to provide the necessary personal protective equipment to our home care workers, which includes personal assistants, so that they can meet the essential functions of their job safely. Now, at the beginning of the pandemic, we understand that, you know, there was a high demand of equipment, right? And so really things kind of hit the fan, and people weren't able to access this equipment so easily. But as of July 30th, which I think is when it was signed, you know, that was a time in which really employers and state agencies needed to be organized and prioritize our needs as people with disabilities to make sure that our healthcare needs are being met. And what we've seen as far as what our coalition has seen firsthand is that unfortunately, while this has improved in some areas of employers, you'll see that in hospitals, you'll see that in homemaker agencies, you'll see that relatively better in nursing homes and long-term care facilities. However, unfortunately, folks who are receiving home and community-based services individually in their homes, this is still a problem to this day.
Yeah, and we know that this was obviously an emergency. I mean, 1 in 500 people in the U.S. have died from this pandemic, and many people with disabilities are more vulnerable than the general population. And yet we see that the response was not, what would I say, it wasn't equivalent to the degree of emergency that there was in facing this. And we know, for example, that half the deaths in Illinois were in congregate settings. So it looks to me like there was a lack of understanding of how to address this emergency. Can you talk a little bit more about that?
Yeah, sure. So, it was required by the Department of Public Health for nursing homes and long-term care facilities to report the cases of COVID as well as COVID-related deaths. That was mandated for the administrators of these facilities to report. And so what has been found in Illinois is at least 51% of the people who have had COVID, who have died from COVID, unfortunately, are people who are in these congregate care settings. The national average is 41%, which is still high. Really high. And but in Illinois, it's even worse. And from my personal opinion, I would question the accuracy of this data. Administrators of these facilities don't necessarily want to admit how many people are actually dying from this. And so I would challenge that the percentage here, at least in Illinois, is greater.
Okay. I know one thing that's happened with the PPE for HSP group is that you went from being primarily focused on services and making sure people had protective gear to a role in advocacy and trying to address the policy decisions that were needed to be made during the pandemic, right?
Yes.
And can you tell a little bit about how that evolved, perhaps?
Yes. So, so while our coalition is PPE for people with disabilities, and our focus is, as what you said, was HSP, which is Home Services Program, which is through the Department of Human Services Division of Rehab Services, and there's a few divisions under the Department of Human Services, like Division of Developmental Disabilities, Division of Mental Health, and so forth. We have strong connections with our Centers for Independent Living, and so that's why our advocacy has really been focused related to the people who are serviced by the Division of Rehab Services. And so through our work, what we decided to do, because we didn't see that, we were seeing that there was an inadequate emergency response occurring for folks living in the community, as well as our Centers for Independent Living not being effectively utilized during this time to serve as an agency for providing such services, such as providing PPE, that we started, first we conducted a needs assessment survey, which is a survey we use to not only gather information about what barriers people are facing at this time and what equipment they need, but that also served as a way for us to create these packages for people. In the scheme of things, what that survey ended up becoming was a tool for advocacy, and we gathered a lot of stories that way. We then decided to write formal letters to the Division of Rehab Services informing of this information. And to explain, we were serving people who live in Chicagoland. So that was the area that we were representing in our advocacy, and through some formal letters we wrote to them, identifying this health disparity, sharing some of these stories, informing them about this concern and gaps in their service. We also met with them a couple times in formal letters, formal meetings, a couple of private meetings we had with them. And really what that made us realize, based on the conversations we had with them, because in ways we were agreeing to disagree, is that this really reflects a larger statewide issue. The way in which the equipment was being distributed within the Department of Public Health looked differently between the divisions, but as well as utilizing effective means of communication and making people aware that these services in fact were available and it was their right to receive this equipment for free.
Yeah.
And then what that led to was us engaging in some legislative advocacy.
Yeah, let me go back a little bit.
Sure.
There is an agency in Illinois that's the primary responsibility to take charge in emergencies, am I correct? And obviously the Home Services Program and the Department of Human Services were not addressing the emergency very well. Were they communicating with the Illinois Emergency Management Agency, or do you feel like there was a gap there? Or
I mean, to be honest, we don't know how what those communications were, how they took place.
Yeah.
What we are still working towards is trying to address that gap. So to explain, we have Illinois Emergency Management Agency. You have FEMA, which is at the federal level, and then every state has their own emergency management agency. So ours is the Illinois Emergency Management Agency, which we'll call IEMA.
right.
And they have a emergency operations plan that dictates which state agencies who they're contracted with to share this, to coordinate services with during these emergencies and disasters. And so that we do have a concern that there is a gap. We do have a concern that the emergency operations plan needs revision and improvements, which is also why we engaged in our legislative advocacy efforts.
Now, I understand that there was some research done to look at other states to see if they were doing something different or better in response to the emergency needs of people with disabilities. Can you tell us a little bit about what you discovered in that process? Or
Oh yeah, sure. So one of our co-leaders is really great and interested in looking at, well, what are other states doing, right? And there are a number of states who have more experience in dealing with emergency preparedness, response, and recovery, because they deal with emergencies and disasters much more regularly than we do in Illinois. And so those are states like California, Colorado. We looked at New Jersey. I'm also connecting with folks in Florida as well.
okay,
And so we did look at, well, what exists there?
right.
And we found that they at least have an Office of Access and Functional Needs, if not an advisory committee that serves such a role to make sure that the people with disabilities needs are prioritized and considered.
Yeah, I know there's a little history here that hurricanes Katrina that hit New Orleans, for example, people were left to die in nursing homes and died, in the flood and drowned. And I think when hurricane hit Houston, there were people that weren't evacuated as well and lost their lives. And So the disability community, I think, has seen that there's a gap when it comes to addressing their needs. And you're saying that these functional needs and access committees at various states are starting to address that. Is that correct?
Yes.
Hopefully.
Yeah, I mean, that's ideally the purpose of them serving in this role. I mean, what's nice about having an actual office is people with disabilities are in hired positions of leadership, right? They're being paid for their time,
Yeah.
just like anyone else. And also it makes addressing these issues, it makes accountability more apparent, right? Like, and you can have an advisory committee, which is great and wonderful. The limitations about an advisory committee is that they can provide recommendations, right? And they can review state and local emergency management plans, which is wonderful. But we also want there to be an office there to make sure that they are implemented in the way in which the advisory committee had seen fit.
Okay.
So yes, there is a trend more and more for these types of committees and offices to be established. What the trend that we're seeing, though, is that they are being formed as a result of grassroots advocacy.
Yes, of course.
And while FEMA does support this, and they view it as best practice to have these offices and advisory committees, I'm still trying to understand and learn more about how can these offices and advisory committees exist in every state,
Yeah.
because we
They
live
don't,
right.
right?
We live everywhere in this country.
Right.
So
Let me ask now. I understand that the legislation that was introduced and passed this year, which I consider to be a huge accomplishment, created an advisory committee for IEMA that has a large number of people with disabilities on it, meeting with the various state departments. Is that correct?
yeah.
And can you tell us a little bit about how that legislation got passed? And then I also understand you're talking about an Office of Functional Need and Access, and that was not included in the legislation, but it is a goal still of the coalition, correct?
It is, yep. So we met our short-term goal of passing legislation, a bill called Senate Bill 921, this past spring legislative session.
You had a sponsor?
We did have a sponsor. Senator Julie Morrison and Representative Jonathan Carroll were our sponsors in each house. Really, what inspired us to engage in this legislative advocacy was a key coalition member named Larry Biondi, who is a good friend of ours. And he was our advocacy manager at Progress Center for Independent Living. Unfortunately, he's unexpectedly died, but his efforts and spirit still exist within our coalition. And so thanks to him and other people, such as yourself, who have experience in legislative advocacy.
Thank you.
Yeah, you were a great part of it. What we did was we started reaching out to a few senators who are in support of our work. Then we came back as a group to figure out what is our ask. Like, what are we asking for here? What do we want from our legislators at this time who are in support of the work that we're doing and the health disparities that we've brought to their attention? And so what we realized is, looking at Illinois' emergency operations plan, it really needs to be reviewed and revised at this time. And so who's going to do that?
Yeah. There are some examples in Illinois where they've kind of failed, I think, right? Weren't there some floods along the Mississippi River where people with disabilities were kind of an afterthought as well?
I mean, any disaster that you have, brings light to a situation which, disaster management has failed.
Yeah.
And so, yeah, I mean, I there's a lot of unfortunate things that have happened during this pandemic. What it has done is really bring light to health disparities that not only exist for people with disabilities, but people of all different groups.
Yeah. The people that are elderly certainly have special considerations when there's an emergency as well.
Sure, yeah. And so with this bill, that it was thankfully passed unanimously, both by the state Senate and the House of Representatives. So we got bipartisan support, which
Yeah.
we're very proud of.
Yeah, and I just think it's amazing that it was all done so quickly. That's
Yeah.
very,
Yeah, it took a lot of work, but we made sure that we worked with other organizations to make sure that there was a cross-disability and intersectional approach that was utilized in drafting
Yeah.
the bill. And so what this bill is calling for is that we're going to have, according to the language, is 9 people, 9 community members with disabilities who have different experience of disability, who represent a diversity of age, gender, race, and ethnic backgrounds to serve on this advisory committee. And then also who will be at the table are key state agencies, so representatives from these agencies who provide disability services. So we're going to have people from the state as well as community members who have experienced firsthand what these issues have occurred during this time to really take a look at these plans and revise them in ways that better address our needs, and I'm sure more than just that work will be done.
okay. Now, I know that process has begun.
Yep.
The committee has not yet met, but it's scheduled to fairly soon, I understand.
Yeah. So fingers crossed it'll, according to the bill at least, it will be established by January.
Okay.
Yep.
I have one more question. Where do you think the coalition is going next, if you could give us a rough idea?
Yeah, so our long-term goal is that we want to create an Office of Access and Functional Needs, and Senator Julie Morrison has already committed to that. So the plan is that come the next year, spring legislative session, we will be introducing a bill to create such as that, and our hope is that we'll name it the Larry Biondi bill.
Beautiful.
Yeah.
Okay, well, thank you for your time today, Kira.
Yeah, my pleasure.
I hope our audience learned a little bit about this, and we know that emergencies are going to happen, so we need to be prepared. And people with disabilities are often at the bottom of the list when it's preparations and thought is being made. So I'm very thankful that this group has been able to move the things forward and to give people with disabilities more of an opportunity to survive and thrive. So
Thank you. Yeah, my
thank
pleasure.
you.
Would it be okay if I just gave my contact information in case people are interested?
I think you could give a phone number.
Yeah, sure. So again, I work at Progress Center for Independent Living. And the phone number you could reach me at there is 708-209-1500, extension 106. Okay, and then if you'd like to, interested in joining our coalition, or you're interested in getting involved with the legislation that we're putting together, we'd love to get further involvement. So.
Okay.
Yeah, thank you.
Thank you. And that's a wrap for our show today. I hope you enjoyed our conversation, and we'll be back next month with a new show. Thank you.
Thanks so much.